Hello, class, and welcome to Chapter 8, Rhythms Originating in the Atria. As you know, atrial rhythms originate in one or more irritable foci or locations in the atria, then depolarize the atria and head down the conduction pathway to the ventricles. Atrial rhythms, and indeed all rhythms that originate in the pacemaker other than the sinus node or SA node, are atopic rhythms. Atopic rhythms are rhythms originating in any pacemaker other than the sinus node. As we all know that P waves reflect atrial depolarization. When a rhythm beginning in the sinus node, it has a positive or upright P wave before the QRS is formed. So, a rhythm that begins in the atria, though, will have a positive P wave also, but it may be shaped differently from the P wave of SA node firing. Because remember, all sinus or SA node firing sinus rhythms or sinus rhythms, the P's are all uniformly shaped and they all look the same. Well, in an atrial rhythm, not all your P's will look the same. They may have different size or shape. The difference in shape of the P wave is due to the impulse beginning in the atria and following a different conduction pathway to the atrioventricular node versus when the sinus node or SA node fires and how the conduction pathway is followed. The word on atrial rhythms. The atria is not considered an inherent pacemaker like the SA node, the AV junction or AV node, and the ventricles, which all pacemakers, each with its own inherent escape rate of impulse. The atria can indeed be classified as another pacemaker of the heart. It can be classified as another pacemaker of the heart, but it's not. It is best known for obstructing the underlying sinus rhythm and producing rhythms with rapid heart rates. Every now and then the atrium will fire an impulse at a slower rate and produce rhythms that have a rate of less than 100 beats per minute. Treatment for atrial impulse firing is aimed at converting the rhythm back to a normal sinus rhythm, or if it is not possible, a less return the heart rate to more normal level of function. Atrial rhythms are extremely variable in their representation. Some rhythms have obvious P waves and others have no P waves at all. Instead, they may have wavy or fluttery baselines between the QRS complexes. Some atrial rhythms are regular rhythms and others may be completely irregular, even can be classified as chaotic. Although most atrial rhythms are rapid, some can have a slower heart rate. Atrial rhythms can have multiple or variable possible criteria. They can either have a matching upright P, an atrial rate, which is the heart rate of the P waves, can be greater than 160 at rest, or no P waves at all, and have wavy or sawtooth baselines between the QRS present instead, or P waves of greater than or equal to 3 different shapes, or premature abnormal P waves with or without QRS interrupting another rhythm, or heart rate greater than or equal to 130, rhythm, regular P waves not distinguishable, may be present, may not be present, can't be sure because you don't know if it's a P or what. Just always remember it is important to note that atrial rhythms can have a positive QRS or a negative QRS depending on the lead in which the patient is being monitored. The first two atrial rhythms we're going to talk about is the wandering atrial pacemaker and the multifocal atrial tachycardia. The wandering atrial pacemaker, or WAP as we call it, WAP, and the multifocal atrial tachycardia, or MAT, MAT, are rhythms that occur when the pacemaking impulses originate from at least 3 different foci in the atria. Each focus produces its own unique P wave, resulting in a rhythm with at least 3 different shapes of P waves. So hint, hint, that's one of the criteria for these two particular rhythms. In order to be classified as either a WAP or a MAT, you have to look for 3 different P waves. So, wandering atrial pacemaker. It has been updated to a new name. The new name is called the multiformed atrial rhythm. So, a WAP can either be called a WAP or a multiformed atrial rhythm. It's just an updated term for a wandering atrial pacemaker. This rhythm, the size, shape, and direction of the P waves vary, sometimes from beat to beat. The difference in appearance of the P waves is a result of the granular shifting of the dominant pacemaker among the SA node, the atria, and the AV junction. Wandering atrial pacemaker is usually a transient rhythm that resolves on its own when the firing rate of the SA node increases and the sinus rhythm resumes and comes back to play. So if we're looking at a WAP, the criteria for a wandering atrial pacemaker or a multiformed atrial rhythm, as it's now known, its rhythm is usually irregular due to the fact that its pacemaker site is shifting from one place to another. Its rate is usually anywhere from 60 to 100 beats per minute, but it may either be a little slower or maybe a little faster depending on how it's firing off. P waves are varied. They can be either upright narrow, downward deflecting, or downward, pointy, notched. It just depends on what foci is firing in the atria. So therefore, your PR interval can be varied due to the varied shapes of your P wave. And your QRS will be the same. It will be less than or equal to 0.12 seconds. So, a multifocal atrial tachycardia, or a MAT, M-A-T. When a wandering atrial pacemaker rhythm is associated with a ventricular rate of more than 100, this is if the heart rate is more than 100 beats per minute, the arrhythmia is called a multifocal atrial tachycardia, or a MAT, a M-A-T, or chaotic atrial tachycardia. That is another name for it. In a MAT, multiple atopic sites stimulate the atria. Sometimes it can be confused with an atrial fibrillation because both rhythms are irregular. However, P waves, although varying in size, shape, and direction, are clearly visible in a MAT versus in a fibrillation. So the criteria for a multifocal arterial tachycardia, or a MAT, is its rhythm is usually irregular, its rate is faster than 100 beats per minute, your P waves are varied, meaning they can be upright, inverted, biphasic, round, flat, pointed, notched, or buried within the QRS. Therefore, it's making your PR interval varied, but your QRS still stays sustained as is norm, less than or equal to 0.12 seconds. So let's take a look at the criteria one more time. So if we're looking to see if a rhythm is a WAP, a WAP, it means basically its rate is anything less than 100 beats per minute. Usually the mean rate is anywhere in the 50s to 60s. So we usually say in a WAP, your heart rate is anywhere from 60 to 100 beats per minute. But being that it's irregular, the mean rate will be anywhere from 50 to 60 beats per minute. Your regularity is irregular. Your P waves, you have to have 3 different shape P waves within the rhythm strip to be classified as a WAP. Therefore, making your PR interval varied, and your QRS is less than or equal to 0.12 seconds. If we're deciding if a rhythm is a MAT, your heart rate or your rate has to be anything over 100. 101, 102, 103, anything over 100, 100. Your regularity is still irregular. Regularity is irregular. Your P waves are 3 different varied P waves, because they have to have 3 different shaped P waves in order to be either classified as a WAP or either a MAT. The difference is the heart rate. Making your PR interval varied, and your QRS falls still within norm, less than or equal to 0.12 seconds. Some of the causes of a WAP can be due to medication, hypoxia, vagal stimulation, or MI. Adverse effects that a WAP can have is usually no ill effects, because it is within a normal heart range. It's just not firing in the SA node. It's more or less firing from the atria. That's the only thing. But long as it still has a healthy, sustainable heartbeat, beats per minute, it's no ill effects. So therefore, there is no real treatment for a WAP. Now with a MAT, it's caused by COPD or some kind of heart disease. MATs show signs of decreased cardiac output because the heart rate is going so fast that the heart can't dump out enough blood out of the ventricles before it's filling up again. So you have a decreased cardiac output. Therefore, some people suffer from lightheadedness, shortness of breath, which is COPD. Treatment for patients who have a MAT heartbeat is sometimes they'll be put on beta blockers or calcium channel blockers to kind of decrease the cardiac output exit, or to slow the heart rate down so it can build up its cardiac output. So if we take a look at this slide, it's what a wandering atrial pacemaker looks like. Let's just go ahead and work it out. Even though it says it is a wandering atrial pacemaker, I just want y'all to see the difference as far as it looks. We're looking, first thing is first, we still have to follow our 5 questions that we have to ask yourself. Are there any QRSs? Yes, we have QRSs. Are they uniformly shaped? No, they're varied. And the next thing we have to figure out is regularity, right? So we're going to figure out regularity. So we're going to go from R to R to R and to R. So we have 5, 10, 15, 20, 3, 6. So this is 26. Then we have 5, 10, 15, 20, 25, 26, 27, 28. Yep, 28, 29, 30. Well, that tells you it's going to be irregular right there because it's more than within two little blocks of each other. 5, 10, 15, 20, 25, 26, 27. This one's 28. Still more than two blocks within each other. 1, 2, 3, 4, 5. 5, 10, 15, 20, 20. Well, 5, 10, 15, 20. 1, 2, 3, 4, 24, 25, 26, 27. So we kind of all over. So we know this is irregular because we have no set pattern. Irregular. So the next thing we have to look for is for every QRS there is a P. Yes, there is. For every QRS there is a P. But there's one slight difference. There's a P, there's a P, there's a P, there's a P, and there's a P. If you look at all these P's, there's at least 3 to 4 different shaped P waves in this graph. That's what we're looking for. What are these P's doing? So yes, for every QRS, there is a P that's married to it, but they are not, they're varied in shape and size. So they're varied in shape and size. So we know we have an irregular rhythm. So we have to find our mean rate and our heart rate range, correct? So we have 1, 2, 3, 4, 5. So our mean rate is 50 beats per minute. So now we need to find our heart rate range. Well, when we're doing heart rate range, we have to do what? We take our biggest interval and our smallest interval and divide that out by 1500. So 1500 divided into 30 gives me this, and then 1500 divided into 26 gives me this. And where's me Where's me calculator? Oh, there it is. So let's take 1500, divide that by 30. That gives us 50 beats per minute. And then if we do 1500 divided into 26, that gives us 57, because remember we don't round up. So our heart rate range is 50 to 57 beats per minute, and our mean rate is make this a little smaller so you can see. Alright, so our heart rate range is 50 to 57 beats per minute. Our mean rate is 50 beats per minute. So what did we say as far as classifications for a WAP? Your mean rate has to be between 50 or 60 beats per minute. Well, there we go, 50 beats per minute. So therefore we have a WAP. WAP. Let's take a look at a MAT. All right, let's take a look at this rhythm. This is going to be a multifocal atrial tachycardia, or a MAT, as we like to say, MAT. So as you know, we have to find out our R to R intervals first, correct? So this is we're going to say 5, 6, 7, 8, 9, 13, 13, 7, 13, 13, 7, whoops, 12, 5, 10, 5, 10, 13. So we know this is irregular because there's no rhyme or reason to it. Irregular rhythm. So we know we have an irregular rhythm. So we know we have to first find our mean rate. So our mean rate is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So we go 12 times 10 gives us 120. Gives us 120 beats per minute. So we know mean rate cannot stand alone. We have to also find our heart rate range, correct? And in order to find our heart rate range, we're going to take 1500 and divide that by our biggest number, which is 13. And we're also going to take 1500 and divide that by our smallest number, which is 7. So we're going to take 1500, divide that by 13. That gives us 115. And then we're going to take 1500 and divide that by 7, and that gives us 214. So our heart rate range is 115 to 214 beats per minute, which fits into the criteria of a MAT because it's anything greater than 100 beats per minute. And that's how you tell the difference between a WAP and a MAT. If you have any questions or you're still feeling a little confused about WAPs and MATs, please send me a detailed text message with your question and I'll be glad to help you out and go over another chapter lesson with you. I hope this helps you in solving atrial rhythm strips. I will talk to you in our next lesson when we're talking about PACs and PAT. PAC and PAT. Thank you and have a nice day. Bye-bye.